Hello, and thanks for tuning in. This video clip shares the tenant perspectives of how to make supportive housing work for Canada's most vulnerable at one Indwell permanent supportive housing site in London, Ontario. Western University, the Centre for Research on Health Equity and Social Inclusion, and Indwell are collaborating together on this research project. This project is funded by the Canadian Mortgage and Housing Corporation National Housing Strategy. As part of a multi-phase research study exploring what makes supportive housing work for Canada's most vulnerable at Indwell's Woodfield Gate site in London, Ontario, tenants participated in video narratives. We asked 5 tenants their perspective of what makes supportive housing work or not work for them. Lorian has a long history of living in a variety of challenging housing environments, including social housing. She uses a power chair and is on a low fixed income. Because of this, Indwell provided her a great option both in terms of accessibility and affordability. She sees the poverty around her and tries to help out as much as she can, and wishes there were more affordable, supportive options available for everyone. Sharing the apartment with her partner, she is hoping to get into a newer Indwell building that offers her a bit more space and accessibility.
There's not a lot to live off of. It's how you buy groceries and keep money for laundry and bus fare. And if you have a telephone, because you need a telephone. So they don't really give you enough. I think the welfare system needs to be adjusted.
Brenda grew up in Canada's East Coast and lived a precarious life of low-income labor and affordable housing environments. She came to London to marry her partner she met online and lives with her now at Indwell. Brenda values her independence and wants to find stable employment. She uses Indwell's mental health support services and values how this helps her. However, she's also honest about her struggles in terms of living in a shared environment and some conflicts with other residents. Her goal is to move to Indwell's new site because it will have a cafe and she wants to work there.
You just see a lot of people and you're like, wow, why are they all doing out on the street and what their reasons are? And people from here telling people go apply for Indwell, their lists are growing and growing and growing that they have to stop them because there's so many people on the list.
Cathy grew up in the foster system and lived in a group home followed by a rooming home. After some difficulties with housing, she wound up in emergency shelter. She was able to stay with a friend after that before being accepted into Indwell. Indwell has been important to her because of her physical disabilities, including current use of a power chair. It was a staff member at Indwell who noticed her worsening condition and connected her with surgical care that she believes saved her life. Cathy engages in as many social activities on site as she can. This has given her social supports that she hasn't felt she's had before.
Guitar jam, I get involved with that. Chinese karaoke. I don't know if I'll sing, but I'll come. But we have the crafts, like I said, I did one of those, and we did tie-dye where I did this. They get you involved. If they, they'll call you up and say, are you coming down?
Sharon lived with her mother and has had some challenges with looking after herself. When her mother aged into a home, her sister helped her into hospital out of concern. From there, she had nowhere to move to in order to be discharged from the hospital. Through the hospital, she was able to find Indwell as a permanent supportive housing option. Sharon has made friends at Indwell and considers it home.
I go to the smoking courtyard and socialize with people there. I socialize with people. It's one sense of belonging. And throughout time, you make friends.
Paul shared with us a long history of alcoholism and housing instability. This included couch surfing with family members and regular use of emergency shelters. Paul's history was a difficult one, with conflicts, frustrations, and many failed attempts to maintain his goal of sobriety. Coming into supportive housing has been a highlight for him. He views Indwell as finally having a place to live permanently and a place where staff will understand and assist him related to his alcohol use. For Paul, he is optimistic that supportive housing is the end to his homelessness.
At Indwell, with this housing, my job is to say that I am impressed. I am very impressed. They're great people. I need this housing. or else I'm on the street. I think I've been working well to make it work.
Thanks for watching some of Indwell's tenants share their experience of being rehoused into a supportive housing environment. For more information and resources, please visit the website www.abeoutshorn.com. Thank you.